I suppose I'd like to thank Dublin County Sports Partnership to begin with, and also TUD and Kieran Collins for organising this. And also a few of the people that I've been involved in working with over the last number of years. So my name is Eoin. I'm a assistant lecturer in TUD and a lecturer in clinical exercise physiology. I'm also a PhD candidate, so I'm in the final year of my PhD. It's been supported by the Irish Research Council and the Alpha One Foundation. So I'm a DCU PhD student, but a TUD staff member at the same time. So I'm, like I said, I'm in the last year of my PhD studies, but unfortunately for me, this last year has kind of been dragging on for over 2 years now. So we're kind of trying to finish and trying to work at the same time as it can be difficult, but we're getting there. So my own research was looking at the impact of exercise in patients with a hereditary form of lung disease that predisposed them to COPD. I'm not going to spend a huge amount of time or any time at all really speaking about that today, but that's just a little bit of my research background. These patients, like I said, had a hereditary form of lung disease which predisposed to COPD, or chronic obstructive pulmonary disease. And it was essentially an incurable disease. But the thing about it is that with COPD, the most effective treatment, even though it is an incurable disease, is pulmonary rehabilitation or exercise training. The key thing is with pulmonary rehabilitation for patients with COPD is that you're not actually treating or curing the condition, you're just managing symptoms. But that's important because it improves quality of life. You're basically training, your lungs are deteriorating over time, but you're training everything to do essentially more with less. And what we used to say to the COPD patients was that if they train like elite athletes, then they will be able to get to a normal level of functioning. So it's quite a powerful message. And when it comes to COPD and pulmonary rehabilitation, it's actually been recommended by the societies that are responsible for kind of managing research output and publishing research output, that when it comes to pulmonary rehabilitation and COPD, they don't need any more studies to determine the efficacy of it. It's been long established that it's the most effective first-line treatment for patients with lung disease. But like I said, that's not what I'm going to be talking about today. I'm going to be speaking more generally about exercise as a form of medicine. So as I understand it, the title of the talk is Exercise is Medicine. I'm going to speak to you briefly about kind of the history of this idea of exercise as a form of medicine, and then just run through a couple of different conditions, common chronic conditions that are predominant in the world we live in today, and the role that exercise has in kind of preventing, treating, and managing those conditions. And also willing to take questions at the end. I'll try and get through it quite quickly. I know we're a little bit late starting. Okay, so this idea that exercise or physical activity, if you like, is a form of medicine is not a new idea. It's a fairly ancient idea, really. It seems to have been with us for as long as humans have been thinking about such things. So a quote from Hippocrates here: "Eating alone will not keep a man well, he must also exercise." And Galen then, kind of considered the grandfather of modern medicine, when he was speaking about exercise, he said, "It's extremely beneficial for health and brings about a well-balanced condition without any undue accumulation of fatness or excess thinness." So it's something that humanity has been aware of for a long time. So if you imagine a drug that had the capacity to reduce the risk of all these chronic conditions, heart attack, stroke, diabetes, obesity, cancer, and the thing about this drug is that not only does it have very few side effects, but also the more that you take of it, the better the outcome. Well, that drug, of course, is exercise. It's been shown to have a very positive impact on all these conditions. Reduce the incidence of heart attack, reduce the incidence of stroke, reduce the incidence of diabetes, obesity, certain forms of cancer, and also Alzheimer's disease. Okay, these diseases aren't selected at random. These diseases are, of course, kind of the major, what are called non-communicable diseases that tend to affect humanity today. Okay, so this list here is old, from 2015, but it's still fairly current. And basically the major non-communicable diseases that we're talking about. And remember, a non-communicable disease is basically a disease that can't be transmitted from person to person. Okay, it's not a disease that's infectious, if you like. We're talking about heart disease. The first two are basically heart disease. Then you have chronic obstructive pulmonary disease, which is basically chronic lung disease. And then, of course, Alzheimer's and other kind of dementias, which again is part of that, that's associated with cardiovascular disease. And then different cancers, and of course, diabetes. And even if you look further down the list there, depending on how you kind of group all these things together, you also have hypertensive heart disease, which is kind of a form of cardiovascular disease as well. Then. And the thing about all these diseases is that they have a lot of common risk factors. And when we talk about risk factors, we're talking about factors that impact the development of these diseases. Okay, and if you're, we talk about exposure to a risk factor, and we can quantify that exposure in terms of the number of years you might be exposed to a risk factor. And if you're exposed for a risk factor for a longer period of time, then that means it's more likely that you'll eventually maybe develop this disease. So we're talking about common risk factors for all these diseases. We're talking about things like unhealthy diets. I'm not going to go into what constitutes an unhealthy diet. Tobacco use, obviously, harmful use of alcohol, and then, of course, physical inactivity is a key risk factor in the development of all these diseases. And that's a powerful message there, because physical inactivity is generally something that you can that can be changed or can be affected in some way. It can be modified. Your exposure to this risk factor can be modified quite easily. And the drug, of course, that we're talking about, that I alluded to in the slide previously, was, of course, exercise. And here's a couple of different names. When you think of exercise as a drug, it could have a number of different brand names. It would also, if it's a drug, it's going to have a dosage. It's going to be, you want to know if it's safe for all ages. Is it safe for pregnant women? Does it have side effects? What are the adverse reactions? How do you administer it, etc., etc. Okay, so basically, exercise is a pretty safe and effective drug, if you like. Okay, so a couple of definitions and kind of ideas or concepts to sort of get your head around to start with. So this idea that we're an exercise-dependent species or a physical activity-dependent species. So this is something that this idea was coined or created or studied by eminent kind of evolutionary biologists likes of Dan Lieberman, where they discuss this idea that humans evolved as a sort of physically active or exercise-dependent species. So physical activity then is generally any bodily movement produced by skeletal muscle that expends energy, and then exercise is generally considered a form of physical activity. Okay, now for the purposes of this talk, I'm going to sort of discuss physical activity and exercise, the same thing. When in reality, exercise is kind of a form of physical activity. Physical activity is any movement, if you like, that involves contraction of skeletal muscle, whereas exercise then is kind of planned and structured training. And from an evolutionary perspective, exercise is quite a recent phenomenon. Okay, for a long part of our history as humans, people tended to want to avoid exercise because exercise involved the use of calories, and a lot of your time was spent being physically active in order to get a hold of calories. So why would you expend unnecessary energy on planned, structured exercise? Okay, it's important to think that, because a lot of what I'm talking about today, I'm going to speak about how exercise can impact not only the development, but also the sort of natural course of different conditions. But exercise is a recent thing, and people struggle with exercise. People struggle having to do exercise. And a really interesting question is why some people are driven to exercise, why some people aren't driven to exercise. But in reality, for all of us, exercise is kind of an unusual thing where we're voluntarily expending calories. So from an evolutionary perspective, it's quite unique and recent, just to bear that in mind. Okay, so what is it about exercise that makes it so beneficial from a health perspective? Let's think about what happens when you're not exercising. When you're not exercising, you're not contracting skeletal muscle, okay? So if you think about coming into maybe attend the seminar, I don't know the circumstances that people are watching, but as soon as you sit down, you switch off all the electrical activity in your legs. That has an impact in terms of the overall calories that you burn. That reduces the enzymes that are involved in the breakdown of fat. Their effectiveness, and this is pretty much immediately reduces by about 90%. Good cholesterol then, good cholesterol, the amount of good cholesterol floating around your blood decreases about 20% in about 2 hours. And then after about 24 hours, the impact of insulin in terms of its effectiveness reduces by about a quarter, and the risk of diabetes increases. That's only after about 2 hours. And we know this from studies that have been done on people who voluntarily engage in bed rest for a prolonged period of time, and that they're monitored over time to see what's changing in terms of their overall metabolic activity. So basically, not contracting muscle for any sustained period of time is not really that good for us. And this is a study here. So this was a study that was done, I think it was in Scandinavia about 10 years ago, over 10 years ago now at this stage. And what they did was, it was a 2-week study where they were looking at sort of young fit males, and they were instructed to voluntarily or to reduce their step count from 10,000 a day to less than 1,500 a day to see the impact on aerobic fitness, insulin sensitivity, and visceral adipose tissue. And visceral adipose tissue is basically tummy fat, okay, or fat in or around your midsection. And what they found were these quite remarkable changes, and this was only in 2 weeks, okay? And it kind of expresses a fundamental truth that your body adapts to stress, and when the body isn't stressed, it will adapt in the opposite way. This kind of idea that you need to use it or lose it is kind of the underlying truth that's being expressed by this study here. And this, like I said, this was 2 weeks, and these were young fit males. Just note as well at the start, they were taking over 10,000 steps a day, which is a kind of a recognized guideline that there is actually reasonably good research to back up the effectiveness of, okay? So the benefits of physical activity and exercise, like I said, when we're talking about physical activity and exercise, I'm kind of talking about the same thing, have been shown across a variety of different conditions. We have here dementia, and this is in terms of prevention, dementia, hip fractures, depression, different cancers. Most of the research on cancer and physical activity and exercise in terms of prevention is sort of focusing on colon cancer and breast cancer for various different reasons. The conditions I'm going to focus on mostly today, and I think I said it at the start, are cardiovascular disease and type 2 diabetes, and a little bit on, I think I'm a bit on prostate cancer now as well. Okay, so we'll start off with cardiovascular disease. So this guy here is a guy named Jerry Morris, and he was a public health doctor, a British guy, and he's kind of considered one of the first people to come up with evidence to show that cardiovascular disease is impacted by your physical activity level, in the sense that the more physically active you are, the less likely you are to develop cardiovascular disease, and the less likely you are to die, or less likely to cardiovascular diseases to be serious. So he did a pioneering study in the 50s on people who work for the London transport system. Okay, and what was interesting about this study is that they took bus drivers and they took bus conductors, and the bus drivers obviously spent all day sitting down. All their working days were spent sitting down. The bus conductors spent all their working days, and those younger members here, bus conductors were people who basically were on the bus, collected tickets. They would have to go up the stairs of the bus to collect money and give people tickets. So they spent their working days predominantly on their feet, going up and down stairs. So there's big differences in the amount of physical activity that these people were doing. And it was an ideal study because other than that, there was very little difference about these two cohorts, or these two groups, if you like. And what they found when they looked at the rates of cardiovascular disease in these individuals was that the conductors were less than half as likely to have a cardiovascular event than the bus drivers. Okay, so all things being equal, the only thing that was different between these two groups was the amount of physical activity they engaged in during their working day, and that meant that they were less than half as likely to have a cardiovascular event, a heart attack. What is cardiovascular disease? So I said this at the start. So cardiovascular disease is basically a disease of the blood vessels. When you think of cardiovascular disease, you're thinking of conditions like stroke, heart disease. Another one is peripheral arterial disease. It's kind of a painful disease that affects the lower limbs when you're walking. So kind of diseases that affect the blood vessels. So it can be described as an inflammatory disease of the blood vessels, if you like. Cardiovascular disease normally develops as a result of exposure to risk factors, like I mentioned before, and I've just highlighted some of them here. And when we talk about people who are physically inactive, we talk about people who are sedentary. And these are the things that lead to development of cardiovascular disease. There tends to be what's called a lag time between the onset of when I say onset, I mean the development, or the beginning of the development of disease, and the clinical manifestation. Clinical manifestation is when something happens, some kind of clinical horizon is reached. And then the duration of the risk factor burden means the length of time that you're exposed to a risk factor, and that's the major factor that governs the development of cardiovascular disease. And what we saw with the London bus conductors was that their risk factor, one risk factor that they had that they were less exposed to, was being sedentary. Okay, and that resulted in less than 50% of incidence of cardiovascular disease in that population. And we see this again here. So this is the nurses' health study. Okay, it's a big study that's ongoing in America where they looked at the relative risk of cardiovascular disease in nurses over a prolonged period of time. And they divided them up into kind of fitness categories. Okay, and what you're looking at here, I think I have an arrow that comes up. So what you're looking at here is the relative risk of developing cardiovascular disease depending on your fitness category. So on the right, in the red box, that's there are most fit, and on the left there we have if you like, or tower number 1, we have the least fit people. And if you compare the most fit to the least fit, they're less than half the chance of having a cardiovascular event over the course of this 8-year follow-up. And these are older women between the ages of 40 and 65. So again, evidence for the impact of fitness level, physical activity level, it's different to fitness level, on cardiovascular disease risk. The reason that we speak about cardiovascular disease so often is that it's basically, and it still is, it always has been, the causes the most deaths. Okay, so around 30% or a third of all Irish deaths tend to be caused by cardiovascular disease every year. This is figures from 2016. The figures have been skewed over the last few years for obvious reasons, but cardiovascular disease is in or around the biggest killer. The number of people that are dying from cardiovascular disease is kind of decreasing because treatments and methods we have for kind of managing the disease are improving, but a lot of people still have it. Okay, and it results in things like strokes, kidney disease, and other associated disease. So it remains the biggest killer, and that's the reason I brought it up. Risk factors for developing cardiovascular disease. A key one is physical inactivity, and I have this kind of highlighted at the bottom down here. What I'm trying to explain here, so this is population attributable fraction, and what this PAR, what this means is that if you removed the exposure to this risk factor, then basically that's the number of people who wouldn't get this disease. Okay, and this is from the Interheart study. So basically, just kind of meant to indicate that if physical inactivity has a direct benefit for all these different conditions. So this is from. I don't have my notes in front of me here. Yeah, but anyway, so the point what we're looking at here, so if you look at the kind of y-axis and x-axis, we're looking at the activity level and relative risk here on the y-axis, so activity level here. So basically, these people out here are more active, these people here are less active. So if we compare the least active to the most active people in terms of the relative risk of having a cardiovascular event, and the events are highlighted down here. So we've got ischemic stroke, heart disease, diabetes, breast cancer, and colon cancer are included here as well. What you see is that going from least to some, you see this steepest fall, and that's particularly apparent when it comes to heart disease and stroke patients. So the message there is that the most favorable physiological changes take place in the reduction of CVD risk factors when you're going from very little exercise to some exercise. So these people who are going from none to some, they're the ones that are getting the most benefit, and that's important. So this is an example of a study that was done a few years ago where they tried to compare the effect of physical activity to some surgical interventions for cardiovascular disease. And a common surgical intervention for cardiovascular disease is stenting. Okay, it's basically where you put in a balloon or something like that to open up a blood vessel. So what they did here was basically comparing the effect of exercise versus a stent and looking at event-free survival. So we had 101 men, average age of about 70 years, but they were recruited after routine angiography. So angiography is kind of where you put a dye into blood vessels. So these would be people with cardiovascular disease. You put a dye into their blood vessels, and then you take a bunch of images to have a look and see where there's blockages or something like that. And they randomized them into a stent group or an exercise training group. So in one of them, they all have cardiovascular disease. One of the groups were given these stents. The other groups were just told to cycle for 20 minutes per day for 12 months. Okay. And the outcomes they were measuring were death, obviously, stroke, any worsening of their symptoms, a myocardial infarction, or whether they had to be hospitalized due to chest pains. And they followed them up for a period of time. Okay. That's over the course of 12 months. So you have your exercise training group and your stent group for cutaneous coronary angiography. So what we have here, I'll bring all these bits up. So following them for 12 months. So here you have your group at the start and your group at the finish. So obviously some of them are going to die. Remember, these are 70-year-old men with cardiovascular disease who, need some kind of intervention, whether it's a stenting or the kind of aggressive exercise training. What they found that after 12 months, the exercise training group did an awful lot better than the stenting group. So 70% of the stenting group are still alive after 1 year, but 88% of the exercise training group are still alive. So kind of the conclusion that you draw is that exercise is better than PCI, so stenting, for stable coronary artery disease. So a particular category of coronary artery disease, and exercise is more effective. It's also cheaper. So it was kind of associated with a higher event-free survival. So the two groups, you have 88% of the cyclists are still alive, whereas only 70% of the stenting group are still alive after 12 months in this particular type of exercise training. And they quantified the savings that were accrued. So this was a study that was done in the States. So they quantified the savings that accrued based on kind of where people moved between different categories of kind of their condition. And they quantified that the exercise training was much more effective from a cost perspective than percutaneous interventions, so surgical treatment, balloon stenting. That's a pretty powerful message, saying exercise training in this particular instance is better. It's not only an effective kind of adjunct treatment, it's actually the optimum treatment. So basically, instead of getting stents, people should be given bikes. Sorry, and yeah, you see this. You see this across the board when it comes to cardiovascular disease. I see someone's put in a chat there. Do I need to respond to that? Someone's asking if their signal's going weak. I suppose I should check that people can still hear me. It's not me, it's coming in and out, is it?
All good now.
Yeah, all good outside. Maybe somebody's Wi-Fi connection.
Okay, good. As long as it's not mine. Okay. So yeah. So what was I going to say? Yeah. So the effects of, we'll kind of rattle through this quick. So basically, exercise is effective not only in prevention, that was your bus conductors, but also in terms of treatment in people who are severely ill, even though it is stable coronary artery disease. That's cardiovascular disease in the arteries of the heart, the things that leads to a heart attack. Exercise can be more effective there as well. Exercise is also very effective in other outcomes in heart disease. Okay, very similar to medicine in certain instances, more effective than antihypertensive. So exercise can be more effective in treating blood pressure than blood pressure medication. It also has the effect of significantly reducing mortality following a stroke. So after a stroke, if you engage in certain forms of exercise training, that can reduce the likelihood that you'll die. Yeah, in heart failure, then diuretics, where it's conceded it's this kind of medication to get rid of fluid, are more effective than exercise, but that's to be expected given the certain peculiar or the unique pathophysiology associated with heart failure and fluid retention. Okay, so that's cardiovascular disease. So now we'll talk a little bit about diabetes. So diabetes, I don't know how many people are in this meeting. I don't know the age profile of people in this meeting, but diabetes is very common. 1 in 19 adults in Ireland have diabetes, and most of them, or not quite half of them, are undiagnosed. There's a lot of diabetics in Ireland, even if they don't know about it. More than 19 people in this room, it's likely someone has diabetes. So it's very, very common disease. Huge costs associated with that as well, because the thing about diabetes is once it's diagnosed, a lot of stuff tends to have gone wrong in the background, and then once it's diagnosed, it's kind of almost the end stage of a process that's been developing for years, and it's associated with things like strokes and cardiovascular disease and heart attacks and all these kind of subsequent health problems that could be quite costly. So exercise, again, very effective in treating diabetes. So this is the diabetes prevention program. So this is a big randomized control trial that was done a few years ago. And they were, again, trying to compare the effectiveness of a drug versus lifestyle intervention. Lifestyle intervention is exercise and diet in this instance. Nothing revolutionary about the diet, and nothing revolutionary about the exercise as well. Metformin, interestingly, is a disease that kind of, in many ways, it's often mimics the effect of exercise. Is often called an exercise mimetic, but obviously there's something about exercise that's slightly different to metformin, because when you look at the results of this study, you see that exercise is much more effective. So here we have lifestyle, and this is in terms of the cumulative incidence of kind of negative outcomes associated with diabetes. So you want this line to be lower. So you see with exercise is lower than metformin, which is the drug, and is lower than placebo, which is what you'd expect. Okay, so again, this is more evidence in a different kind of condition where exercise is more effective than drugs. In terms of the development of diabetes, then again, so in terms of the reduction in risk, you can see that moderate exercise, and by moderate exercise, I just mean around about 150 minutes a week, which is kind of what you should be doing. We see that exercise has a 58% reduction in the development of diabetes. This is in the controls versus metformin, okay, which is that kind of almost it's a key medication that's used for diabetes. So exercise is very, very effective when it comes to treating and preventing diabetes. Cancer, same idea. So these are figures from the National Cancer Registry, looking at kind of the incidence of cancer in Ireland. So focusing here on prostate cancer, colorectal cancer, and lung cancer, three very common cancers. And what you see is that when it comes to the development of cancers, and this is a study from back in the 90s, where they looked at 13,000 men between the ages of 20 to 80, and where they looked at the kind of relative risk for the development of cancers. If you look at this light blue rectangle here versus the purple rectangle here, this is the incidence rates. Okay, so in terms of the relative risk, you can say that these guys are 3/4 as likely to develop cancer as these guys. They're less fit. So this is the least fit, this is the most fit. So these guys here in the most fit group are less than a quarter as likely to develop prostate cancer as the guys in the high fit group. So again, you're seeing the same pattern when it comes to kind of the development of our understanding of the role of exercise and cardiorespiratory fitness, where you kind of look for patterns, and then we kind of look for mechanisms after that. Once you've identified the pattern, you kind of know where to look. Dementia as well, an increasing problem in Ireland. These are the figures. This is from 2013. So almost 50,000 people currently living with dementia in Ireland. These numbers are increasing. It's associated with the aging population. Big risk factor for dementia is obviously aging, but dementia is also associated with cardiovascular disease, and vascular dementia is a serious problem. Every year in Ireland, 4,000 new cases of dementia, but the powerful thing is that epidemiological studies have shown that exercise has a pretty significant effect on the development of dementia and other cognitive diseases. So again, population attributable factor relates to kind of, if you removed that factor, if you removed physical inactivity, then 32% of the incidence of the disease might disappear. Okay, that's what the figures suggest. So we've looked at kind of the role of exercise in cardiovascular disease, diabetes, and cancer. So what is it about exercise that's so good for us? Well, basically, when you're exercising, you're activating skeletal muscle. When you're activating skeletal muscle, you're releasing all these things that are released from skeletal muscle that have a role. It has kind of antioxidants, it's anti-inflammatories, it roles in cell repair, DNA repair. It's like kind of, in a way, you're kind of damaging cells, you're creating stress, but then you're cleaning up afterwards. Okay, exercise also has a role in terms of kind of burning calories, lowering blood sugar, lowering blood fat, lowering cholesterol, all these things. It kind of it brings about stress, is the way to think about it. Okay, without going into too much detail. Exercise is stressful, but it's useful stress. When you think back to this idea of use it or lose it, you don't use something, you're not stressing the system, you're not encouraging it to respond, repair, and adapt itself, and that's what exercise is doing, it seems. Muscle contraction seems to be key. And the reason muscle contraction is key, and it's kind of listed some of the different chemicals that are released by muscle and the impact that they have. So these are the things that are released by muscle that we've identified so far. These are some of the organs that are impacted by these chemicals that are released by muscle. Okay, so what you're looking at there is basically every single organ system in the body is being impacted by exercise, both an acute and a chronic. When we talk about acute, we're talking about immediate. And I started this talk giving you the example of coming into a room, sitting down, switching off the activity, and you're switching off the electrical activity in your legs. You're not using your legs, not using your big postural muscles, big posterior postural muscles, and all of a sudden, all of these different chemicals that are released by muscle aren't being released anymore. And that has immediate effects in terms of fat breakdown, insulin sensitivity, all these kind of things. These are the other different systems, they're the acute effects, but there's also chronic effects. So chronic effects are kind of training effects brought about by exercise. It also has an effect on your brain. One of the things I didn't list there. Okay, so exercise improves blood supply to the brain, improves kind of the release of certain neurotransmitters, enhances oxygen supply to the cells. It brings about nerve cell growth and promotes neuroplasticity in the brain, and all these other things that can be improved as a result of exercise. Your attention span, your ability to process information, etc., etc., etc. All these things have been shown by research. So a lot of these things, so you're kind of releasing things from your skeletal muscle, you're also having a kind of a positive effect on a number of different domains of cognitive function. Okay, so we'll speak briefly about how much exercise you need to do. So in general, you're talking about 30. So the kind of national recommendations in Ireland are 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous intensity exercise per week. And you can build up, this is in terms of the minimum amount that you need to do to maintain health. Okay, and you can kind of think of it as about 30 minutes a day of moderate intensity exercise. Okay, when you talk about moderate intensity exercise, you're talking about exercise that does make you breathe a little bit faster, so it makes you sweat a little, makes you go red in the face. So exercise that kind of stresses the system. That stress thing is key. Okay. Another way you can quantify exercise intensity is in terms of METs. I have this up here. I'm not going to go into METs, but basically they're metabolic equivalents. Basically, it's a way of when you're sitting, resting, your metabolic activity is at a certain level. When you start to walk, then your metabolic activity is at another level. When you start to run, your metabolic activity is at another level. And METs can be useful to quantify your exercise intensity. So a moderate intensity is around about 3 to 6 METs. That basically just means you're stressing the system a little. You're having to breathe that bit harder. Your heart rate increases. You start to sweat a little. And that's what you kind of need to do every day. You sort of, if it's 150 minutes a week, that's sort of maybe about 21 minutes a day, but sort of aim for about 30 minutes a day is good. And that's in or around 10,000 steps as well. And it's been shown that 10,000 steps is a kind of a useful barometer when it comes to kind of monitoring your adherence to sort of physical activity guidelines. Physical activity guidelines changes according to age. So children should be probably getting, and when we say children, we're kind of including adolescents in that as well, should be getting about at least an hour a day. And it also changes as you get older as well. In terms of whether Irish people meet these guidelines, it can be difficult to get these figures. It's kind of a difficult thing to measure, but in general, we're probably on from an international perspective, we're not doing too bad. In America, it's generally about 20% are meeting the physical activity guidelines. In Ireland, we're in or around 46% of adults seem to be meeting the physical activity guidelines. There's differences across the age groups as well. So as people get older, they're less likely to meet the guidelines. Young people, that tends to be a particular problem. There's differences between males and females as well. They can be particularly acute in adolescence. Young girls tend to be consistently lower than males. So if you are meeting it, well done. You're in the 46%. The rest, not really getting it. And there's a couple of different reasons for this that I'll discuss now. So, like I said, the percentages achieving the guidelines kind of decreases with age, and you can kind of see the differences there in the sexes as well. In general, more males are meeting the guidelines than females, and you can see that pattern consistently across these age categories as well. Yeah, the decline that you see up towards kind of in older populations is particularly concerning from a public health perspective, because obviously people are living longer, and a lack of physical activity, particularly as you age, can bring its own quite unique problems. So as you age, just to continue on that theme, as you age, for kind of between the ages of about 40 to 70, you're sort of losing about 8% of your muscle mass on its own. Okay, once you get over 70, that annual loss, so that's an 8% loss per year. Once you get over 70, that annual loss increases to about 15%. So like I said, this is becomes a really important problem as people age, as this decline in muscle mass accelerates. So what we're looking at here, just to give you so this is a kind of a cross section of someone's upper thigh. You can have adipose tissue there, muscle in the center, and that's bone. And this here is an example of what happens as you age. So as you age, the quality of muscle decreases. Okay, so this is your average. This is an example of an average 74-year-old man. This is an example of an average 70-year-old triathlete. And the message I'm trying to convey here is that while you will lose between certain ages, you start to accelerate this loss of muscle strength, and this acceleration of loss increases as you get older. It is possible to interrupt it, and exercise training is the way you interrupt it. Particularly resistance training becomes particularly important as people age. And this is an example of a study of 100 frail men and women. So their average age was 87 years. They were in long-term care. They did 10 weeks of training. So this is from the mid-90s, 10 weeks of training. And you saw a 113% increase in strength. Take-home message: that it's never too late to start engaging in resistance training. And if as you age, it's probably more important than resistance training is probably more important than any other kind of intervention you can take on board to improve your health. There is no minimum amount of physical activity required to achieve some health benefits. In fact, people going from nothing to something achieve the most benefit. I highlighted that earlier when we were talking about cardiovascular disease, that people going from nothing to something, they're the ones that benefit the most. And this is a graph adapted from the UK physical activity guidelines. And basically, we're looking at people going from, this is overall accrual of health benefits, not just cardiovascular disease, not just in terms of improvements in strength. This is overall health benefits. People going from something to nothing, they get the most benefit. So that's kind of sort of where I'm trying to go with this. And this is a book that I mentioned, Daniel Lieberman earlier. This is a book that he published recently called Exercised, and the name is very appropriate because he's trying to convey this idea that people are exercised about exercise, that they're worried about exercise, that a lot of people find exercise difficult. And there's a reason that a lot of people find exercise difficult is because exercise is a relatively recent phenomenon from an evolutionary perspective. So it's hard, it's difficult, it don't have time, it doesn't fit into our lives today. But really the message he's trying to get across is that even if you do a little bit, you will get health benefits, because it might seem like getting in 150 minutes a week plus, 2 or 3 sessions of resistance training is beyond you. Even a little bit is going to, 20 minutes a day is going to accrue health benefits. When it comes, and so the argument that you don't have time, when it comes to the impact of cardiorespiratory fitness, this is basically if you exercise more, you tend to become fitter. The higher fit people basically will live for longer. So this idea that you don't have time to exercise well, and maybe if you don't have time, you should be exercising because that'll give you more time. So what you see here is that the people with the lowest cardiorespiratory fitness tend to die younger than people who have, it's basically saying that when it comes to kind of the impact of these risk factors on overall mortality, low cardiorespiratory fitness has more of an impact on all these other risk factors here: obesity, smoking, high blood pressure, cholesterol, diabetes. You see that there. So ultimately, we should all be exercising. It's a very effective form of medicine, and you should be aiming for about 30 minutes a day. It's completely safe in pregnancies, no particular side effects, it can have a very positive impact on a range of different health outcomes. So hopefully given you a reasonably short, succinct summary there, some of the research surrounding exercise and its impact on overall health, and I'm happy to take any questions.
Hello.
Yep.
I have a question about the level of confidence you have in the figure of 46% of the Irish population, doing the recommended amount of physical activity in Ireland. So where that figure came from, what type of study, and how confident would you be in terms of the measurement of physical activity that was used to generate that figure?
Okay, so who's that?
My name is John Carney. I'm in TU Dublin. I'm a nutritional epidemiologist. So I'm in the School of Biological Sciences, but lecturer in nutrition and epidemiology.
Very good. Thanks for the question, John. So with all these kind of studies, there's going to be published. So this is from the Irish Physical Activity Fact Sheet. So that document that's published from the World Health Organization. There's various different figures going around. So Healthy Ireland publish regular updates. So that's a cumulative figure of all adults, and then they break down by age group as well. A lot of the physical activity data that's collected isn't collected directly using wearables. A lot of it is collected using self-reported questionnaires. I know Tilda do a lot of work on this as well. How confident am I? I mean, how confident can you be with any of this data? There's a lot of people going around collecting it. It's probably in or around the correct figure when you look at it all together. But there's going to be, I mean, really,
I suppose I was wondering that whether it was, the self-reported kind of questionnaire data, or was it using some sort of, measuring device type thing, wearables, as you say. So, I mean, I was just curious to know, it's a bit like using kind of the, obesity figures. Sometimes these are good for big population and country comparisons, but maybe less so as actual literal figures. So good relative, but maybe less actual.
I think the majority, I think probably all of it is self-reported questionnaire, when they do something like the International Physical Activity Questionnaire, where you ask people about their physical activity habits over the previous 7 days. I think a lot of it is just that figure is probably from self-reported questionnaires.
Thanks very much for that.
Okay,
Oh, and Jacqueline has her hand up there.
Jacqueline?
Hiya, Eoin. Yep, thanks. That was really God, that was intense, as in there was so much information. It was really enjoyable. My question is, I work with the community and deliver a lot of programs, so I wondered how much the study took on board people's diet, or is the paper, the study that you've been carrying out, is that solely to do with exercise as a solution to, as an alternative to medicine? So I suppose my question is, was diet considered in that research?
So I was just giving you a summary of a bunch of different research there, really, Jacqueline. Diet obviously plays a role, but I'm not a dietitian, I'm not a nutritionist. I'm all about exercise and the impact of kind of moving on your overall health. Diet is going to play a role, and this idea that exercise people are often accused of maybe suggesting that you can kind of outrun a bad diet. That kind of idea is a little bit harmful, probably. You need to I would sort of argue it from the other perspective. You won't be able to, well, if you look at it from the perspective of an athlete, you won't be able to perform to your optimum unless you're taking in sufficient nutrition and calories to allow you to have the energy to engage in all the training you need to engage in. So kind of like from an athlete's perspective, you need to be fueling correctly. But then from the perspective of an average person, diet, so they're kind of two separate things, but both of them play a role.
I hear you that as well, actually, because I'm quite tired today, actually, that they're all different studies, so they're not just one study exactly. So you've given a very, very broad overview. Is it possible for us to get a copy of what you presented?
Sure. I'm happy.
That'd be fantastic, because it's good to reference back, because it was a lot of information to take in after a busy week and work so far already.
It's only Wednesday.
Oh, well, I had the Irish Heart Foundation out yesterday, and I mean, I've had them out twice in North Clondalkin doing screening for heart disease, and it's just been amazing, the results. We've probably screened 100 people on 2 visits in the last month, and the results, like, where some people were advised about their diet, their health, increase exercise. Even myself, high and low blood pressure, and I'm an athlete. I run 2-3 times a week. So I would say the diet is fundamental to, like, my cholesterol was up. So a lot of that information is really helpful for me, because you can be giving out advice and information and maybe not always take it on yourself 100%. So that's really good. Thanks, Eoin.
Very good.
Hi, I have a question.
Okay.
how could we improve promotion of exercise? Even though I know it's very clear that exercise is really good for you, and that's just been around for a long time. But how can we move it forward for people that they feel as though it's their bodies and they don't care? They just don't care, but the outcomes itself, they just gonna reflect in bad health.
So was that Jonathan? Is that correct?
And Jonathan, yeah.
Yeah. So it's a great question, Jonathan. How do we get people to start moving? There's a lot of people trying to figure this out. So behavior change is a really key area, and it's a really confusing area as well. A lot of people are trying to figure this out. I suggest, based on Daniel Lieberman's research, the Harvard guy, his book I showed there, I would suggest that the reason that people find it difficult to exercise is that we haven't really evolved to exercise as we think about it in a contemporary sense. We've evolved to engage in physical activity, to be physically active throughout the day, as opposed to engaging in exercise, as opposed to going for a run or going to the gym. These kind of things they're add-ons to our life at the moment, to the way that we live our lives at the moment. And I think that's why it's kind of difficult. And a lot of the time, a lot of the guidelines maybe set too high a bar, and people think, well, if I can't do that, then what's the point of doing anything? One of the things I was trying to get across to everyone today was, take your eye off that for a second and just try and move more. Okay, any kind of movement. The people who benefit most from a health perspective are people going from nothing to something. You know, there's a really good talk on YouTube called 23.5 hours. It's a physician in the States, and he talks about basically the central tenet of the talk is that you have 23.5 hours in every 24 hours to do your look at screens, to sleep, to sit, to watch TV. The other half an hour, use it to move. Okay, there's even evidence from studies that have been done in the States where people in America, I think, watch on average, I think it's some ridiculous figure of off the top of my head I can't think, but it's a certain number of hours of TV a week, and they've shown that people who, even during ad breaks when they're watching TV, get up and walk around the couch, their health outcomes are drastically improved. So it's kind of movement. It's going from no movement to some movement where you get the most benefit. So I think maybe sort of softening the message, not criticizing people, allowing people to be more compassionate with themselves, and really just getting people moving. So physical activity maybe more so than exercise. You know, it's like active commuting, walking to work, walking upstairs, all these kind of things. But remember, from an evolutionary perspective, we are conditioned to save energy. We don't want to expend energy. Okay, exercise is a really recent development. So when you're exercising, and I confess I do exercise quite regularly, but it's against the evolutionary imperative that has kind of got me here in the first place. So that's important to bear that in mind.
We have Jacqueline again with her hand up there. Eoin.
Yeah, go ahead.
Thanks a million. I just thought of something there because I was at the Women in Sport conference at the start of the year, and I wondered, is there going to be any talks like this for the secondary schools? Because given that there's such a huge dropout rate in young girls when they move to secondary, it's something I really feel passionate about encouraging young people to do sport, any sort of sport that they're interested. And I love the slogan that exercise is medicine, because not to everyone, but I think it sends out a very clear message that you can, get well. If you're not 100%, that you can maybe increase your percentage of feeling you're increasing your well-being. And just on that guy's point, I can't remember his name, I would often say to people that I work with in the county, have you ever thought about when you're older, if you're not active now, how you can prevent maybe illness and sickness and reduce your time waiting for hospital appointments and time sitting in A&E or at hospitals, when you can be out enjoying life and be in control of that. And we often don't think about in 30 years time. And if we do maybe make slight changes, little changes now, how we can increase that benefit for later on in life, because we don't always think of the long-term goal. We might just want instant gratification or weight loss or, you know, something instant.
There's an idea that's out there, this idea of, that's a really good point, Jacqueline, that kind of the impact or kind of where you see yourself in a few years' time. There's this idea that exists out there of what's called your marginal decade. Okay, so your last decade of life. How do you see yourself during your last decade of life? And kind of aim for that, okay? And then give yourself the best opportunity to be, you know, a highly functioning individual in your last decade of life. Because I showed you there what, you know, once you hit the age of 40, you start to lose muscle every year, okay?
Yeah, I'm definitely in that category.
And then as you get older, that kind of rate of loss increases. So the factors that impact how quick, remember that's an average figure, but the factors that impact that rate of loss are, one, the kind of peak that you reach, okay? And two, then how you kind of manage that decline, what you do to retain that muscle function, you know? So you need to, you know, this idea, you need to use it or lose it is really important. So, you know, just because you need to kind of aim for that point in your life where you know, what you feel like might be your last decade. What kind of level of functioning do you want to have as you enter that? Okay, and how do you get there? Do you need to make yourself stronger? Do you need to make yourself fitter? Etc. etc. Just I see Thomas has stuck a point in the chat, stuck a note in the chat there that I'd like to comment on. So he said, if people often mistakenly think they need to do 30 minutes straight, and that I'd well believe that that's the case. And he mentions that exercise can be taken in 3 10-minute blocks. That used to be the case up to about 3 or 4 years ago. And the American College of Sports Medicine came out and said, no, we no longer need to even do it in 10-minute blocks. Any physical activity counts. The reason that 10-minute block rule was there, or that kind of 10-minute block kind of advice was there, because we didn't have the evidence to say that exercise accrued in less than 10 minutes was beneficial. But now we know that any exercise or any movement at all is beneficial. So it doesn't even have to be in the 10-minute block. So any movement at all counts.
Even housework.
Absolutely housework, garden, you know, even so there's a study that was done a few years ago where people are looking at the physical activity levels and the energy expenditure of what are called the Hazda tribe in Tanzania, and they compared them to the average American. What they actually discovered were that the physical activity levels and energy expenditure were actually quite similar. So these are people living what was essentially a Stone Age lifestyle, and people in America who are living a modern lifestyle, the energy expenditure, physical activity levels were actually quite similar. So what does that tell us? The energy expenditure levels were quite similar. What that tells us is that there's something about even the quality of being inactive that's important. And the big difference in the quality of inactivity in your average American versus the quality of inactivity of your average member of the Hazda tribe in Tanzania is that even when they're resting, they're contracting muscles. So muscle contraction is absolutely key. And any form of activity involves muscle contraction, and that can have a positive impact.
Thanks, Eoin. Thanks, everyone, for your questions. Just before we finish up, I'll give one last opportunity if anyone has any last questions there. No? Okay, so I'd want to thank all of you for joining us tonight, particularly Eoin, for your talk. It was very interesting and insightful.